The tongue is one of the strongest muscles in the human body and plays a major role in feeding, oral hygiene, speech, and dental-related development. The frenulum is a small tissue attachment beneath the tongue that essentially anchors it to the floor of the mouth. The manner in which the frenulum is attached affects tongue mobility and overall function. Tongue tie is a term commonly used to describe restricted movement of the tongue, oftentimes adversely affecting breastfeeding and speech. The lips allow us to develop speech and facial expressions, but they too can affect oral hygiene and are crucial in infant feeding. The thickness, length, and point of attachment of a lip frenulum are all factors that may negatively affect nursing. There are two distinct types of tongue tie that specifically affect mobility and function of the tongue. They are anterior and posterior tongue ties. Anterior tongue tie is characterized by an unusually short frenulum, causing the tip of the tongue to be anchored to the floor of the mouth. The tongue is essentially tethered and unable to comfortably protrude upward and forward. Infants unable to extend their tongue over the ridge of their gums often experience difficulty latching and may cause significant discomfort or even trauma to the mother's breast. Posterior tongue tie is characterized by a strong attachment beneath the lining of the tongue. This is difficult to see in the mouth, but is most commonly noticed during breastfeeding, while the infant strains to latch and draw milk from the mother's breast. Posterior tongue tie may also be a source of difficulty swallowing and excessive air intake, as it prevents an infant from achieving an adequate seal while drawing the nipple to the palate. The lip frenulum is located inside the upper lip, often between and above where the front teeth would be found. Although most infants have some degree of an upper lip tie, a low, attached, and thick frenulum can restrict movement and prevent the upper lip from flaring, which is essential in creating an adequate seal with the breast. Straining with the upper lip turning pale in an attempt to feed, a painful latch, and cracked or bleeding nipples is often a sign of a lip tie. If the frenulum of the upper lip is tight enough, infants may not even be successful feeding from a bottle. It is extremely crucial to note that the simple existence of a frenulum does not necessarily indicate a true tie requiring revision or a surgical release. Your breasts are unique to you. Although they come in all shapes and sizes, no two breasts or nipples are alike, even on the same person. Certain nipple shapes in particular may make breastfeeding more challenging. Most breastfeeding mothers experience a heightened awareness of different nipple types, shapes, and sizes. Often, differences in nipple shape and size are due to normal postpartum skin changes, or it may be directly related to an inexperienced, incomplete, or shallow latch. Normal nipple shapes tend to extend easily. Flat nipples, on the other hand, do not generally become erect or protrude, even with stimulation. Inverted nipples retract inside the breast, but may protrude with stimulation or cold. A simple pinch test can determine the difference between flat or inverted nipples. Mild nipple elongation is normal and to be expected immediately after nursing. Moderately elongated nipples, however, may result in latch issues if the nipple extends too far, causing the infant to gag with a deep latch. Most nipple injury results from a poor latch. When the latch is incorrect, the infant generally attaches to the shaft of the nipple with no further breast tissue filling the mouth. Identifying a shallow, improper latch is possible by removing the infant from the breast and then evaluating the shape of the nipple. If the nipple looks creased or drawn into a point, like a brand new lipstick, this may be a sign that the infant's latch is shallow. If the infant is struggling to feed, the milk supply is low, or conversely breast engorgement occurs, the infant may suck harder in an effort to transfer milk and subsequently cause blistering. A shallow latch might cause cracked and/or bleeding nipples. While some initial discomfort is expected, nipple pain occurring between and/or during feedings is not considered a normal part of the breastfeeding experience. Nipples that become cracked or blistered generally require special care. Breastfeeding assistance from a knowledgeable IBCLC can often help mothers address and correct these problems before they progress.